Hello everybody, this is Dr. Tyler Evans from Arete Chiropractic coming at you live with the research moment today. It is cold in New Hampshire. It's January 31st and definitely feels like it. But today I want to bring a little bit of information to you about why the neck, the upper neck, could actually affect all the way down in the low back. Now, every time I do this video, there's this picture of this little guy right up there, and he's in the background. And I refer to him to my patients quite a bit in the office because we're always looking at how the upper neck affects posture and how the nervous system functions and how that's connected. There are a few basic principles to how the upper neck moves and how it distorts the nervous system and can affect your whole body, making your whole body hurt, even your low back. And you may get like nerve pain or sciatica or low back pain from your upper neck right up here being out of alignment. Now, we've talked a few times on our videos about how that very top neck bone, the upper cervical spine, the atlas, is the most complex joint in the spine. It's also the most freely movable joint in the spine, but it houses your brainstem and the very important director of your nervous system. So, what I want to explain today is this paper that I'm highlighting was written in 1988 by John D Grostic, a highly respected doctor of upper cervical chiropractic care. It's called the Dentate Ligament Cord Distortion Hypothesis. This was way back in the day, but this book was then written, and many other chiropractors have used the information that Dr. Grostic researched and brought to light. But the Upper Cervical Subluxation Complex by Kirk Erickson, that textbook there, is really where you'll find this paper today, because you can't find it online anymore, but or anywhere really, except for in Research Journal. But this information is important to get out there because this is real science, and it really matters to the people that are struggling with back pain and body pain. And the upper neck is a solution and oftentimes a very big piece for that. And so this is called the dentate ligament cord theory or cord distortion hypothesis. But what happens is we have a misalignment in the upper neck, and I've shown you before that upper neck bone, it can move basically 50% of the flexion and extension in your neck comes from C1 moving under the occiput, the base of your skull, and then C1 moving on C2 is rotation. So 50% of rotation comes from that upper neck bone moving on the second bone down. And so when it goes out of alignment, what can happen is the body can do this. Now, what is happening here? The head is tilted, okay? The shoulder is off, the hips are off, and then there's this short leg on one side. Now, we're not talking about bone short, we're talking about muscles tight, pelvic girdle. The pelvis is twisted here, and so it basically pulls the leg up. Okay, so that's what we're always checking for in our office, as well as scanning. But that leg check and that pelvic twisting, that tells us that the upper neck is off. Why? Okay, well, why could there be an upper neck problem? Why could it affect the low back? Because of dentate ligaments. That is one piece of it. But in the upper neck, here's C1. Here's that very top neck bone. What can happen, and this is when it's in normal position, these little ligaments, they actually attach from the bone itself into your spinal cord. And so when the bone twists or goes out of place, these little ligaments can tug and pull on the cord. What does that do? It distorts the cord. Why is that a problem? Well, because if we look here at the cord itself, here is a cross section of the brainstem of the spinal cord. Here is the actual neural tissue in the cord. And then here's the edge of the outside of it called the pia mater. And then the dura mater is this dark purple line here. But what we have is these little ligaments actually attach right here. This is, right over here. This is a dentate ligament attachment right here and right here. And they can actually pull on that cord tissue. And what does that look like? Well, right here. So here is a picture of, here's a picture of the ligament itself. This is the dentate ligament here attaching in, and it can pull on. This is the spinothalamic tract, but the actual one that causes more of the twisting is the SpinoCerebellar tract, but these tracts are right here and right here. Okay, they're right on the edge of the cord. See that? And so if those ligaments pull and they tug, because that bone is twisted, that upper neck bone where it moves more than any other joint in the spine, it can twist out of place and pull those cords, those nerve tracts right up there at the base of the skull. It's actually shifting everything all the way down, pulling the cord, tugging the cord. And so when we check somebody in our office, they come in, they lay down on the table, if they're out of alignment, what we find is that their heat scan will be out of pattern, and then, in pattern, and then when they lay down, they will have a short leg on one side, and that pelvis is twisting, causing tension in the low back, and possibly even tension on a tract that causes pain. So maybe like sciatica might be happening, or pain down the low back, pain down the leg. And then what we'll do is we'll lay them down on the upper cervical table. We'll gently correct that C1 without twisting or popping. Gently get that bone back into the right position. Get that head back on straight. And when we change the alignment right up here, it can shift everything all the way down so that short leg will balance out. The hips will level out. Hips will level out. And so then what we do then is we put them back up on the table and the legs will be balanced. And so changing right up here will actually shift that low back and shift that leg length inequality, that difference in leg length. And that immediately changes the tension in the low back. So there can be a direct neural compromise right up here, direct nerve problem right up here, because all the nerves that come down from your brain, that go to your low back, they go right through your neck, right? And so if you've had a car accident, and this is a big one, people, I just talked to somebody the other day, good patient, been in here, for a couple of, year or two, been under care, been doing really great. Immediately after the car accident, started to feel some tension in the neck and then low back tension. Well, we could explain that it's, from the shifting of the body forward and back. But we also know that when we shift this bone right up here, if it shifts out of place, it can immediately cause that cord tension. So if you've been struggling with low back pain, sciatica, and even just global body pain, pain throughout the midsection, that can actually be an effect of that upper neck being out of place. So if you have more questions about it, definitely feel free to give us a call. Let us know. We are in Portsmouth, New Hampshire, but we're happy to educate and communicate to anybody out there that has questions. Again, my name is Tyler Evans from Arete Chiropractic, and this is the Upper Cervical Research Live Moment and the Dentate Ligament. So if you have questions about that, give us a call, and if not, have a great day, and we'll see you next week.